Thank you for joining us for our postgraduate positions in association management webinar. This is something that we've been putting on for a few years now, and it has always been just a great resource for those of you who think that this might be a path for you. I know Brittany from APHA and myself both attended last year, so just keep questions in mind. We definitely welcome those. You can put those in the chat, but also keep in mind that we're going to have breakout rooms at the end for any specific questions that you have. All right, so with that, we'll get started. All right, so go around for some introductions. So we've got lots of fellows, residents here. So I'll call on you guys, and if you could just share your name and your title, and then we'll get going. So Marissa, let's start with you.
Hi, everyone. My name is Marissa Brooks. I am one of the ASHP Executive Fellows in Association Leadership and Management.
All right, and Drake.
Hi, everybody. My name is Drake Ryder. I'm the Executive Fellow in Healthcare Association Leadership at AMCP, which stands for the Academy of Managed Care Pharmacy.
All right, Miranda.
Hi, everyone. I'm Miranda Steinkopf. I'm the Academic Leadership and Education Fellow with AACP, which is the American Association of Colleges of Pharmacy.
All right. How about you, Lori?
Hi, I'm Lori Lorenzo, and I'm an executive resident with the Education Department at APHA.
All right, thanks, Lori. Tanya?
Hi, everyone. I'm Tanya Ganem. I am the Executive Fellow at NACDS, which is the National Association of Chain Drug Stores.
And Alexis?
Hi, everyone. I'm Alexis Coronis, and I am the Executive Fellow at the Pharmacy Quality Alliance.
My name is Jessica Satterfield. I'm the Executive Resident at NCPA, the National Community Pharmacists Association. So with that, we'll get into giving you a little bit of background on each of our organizations. Right, we'll start with AACP.
Thanks, Jess. So as I just said, I am the Academic Leadership and Education Fellow with AACP, and our headquarters is located in Arlington, Virginia. My fellowship position is a 2-year fellowship, and there's just one of me, so just one fellowship position. And because it's a 2-year fellowship and I just started in July, we won't be recruiting for new fellows until July of 2023. Well, that would be when you would start. So recruitment would be that winter before. But still want to tell you a little bit about the program, just as you're thinking about things over the next couple of years. So you can see a couple unique features that I listed here about the fellowship. So really the big focuses for me as the fellow are on education and practice innovation, because we are the American Association of Colleges of Pharmacy. Our members are faculty members at all the schools and colleges of pharmacy, as well as all of the schools and colleges themselves as member organizations. So we really focus on doing things for those faculty members and making sure that we are supporting them and therefore supporting pharmacy students. So a lot of my work focuses on our strategic priorities that have to do with education and practice innovation. So some of the programs that I work on are things like institutes, where we bring teams of faculty members together to learn about different topics and then take those back to their schools. So things like Digital Health Institute or Equity, Diversity, and Inclusion Institutes. I help to create those and then also to moderate some sessions during those programs that we have for our members. I help with planning and putting together our annual meeting every year. And then also a national summit that we're putting together for this March that I'll talk about a little bit later too. And then I also help to create products and services for our members. So things like different work groups to help them implement things into the curriculum and things like that. One of my biggest charges as the fellow is to focus on the Center to Accelerate Pharmacy Practice Transformation and Academic Innovation, which is a huge mouthful, but we basically just call it the center at AACP. And we're really excited about launching this new center just recently, and I'm one of 3 staff members who's a part of that. So that summit that I mentioned, it's a national summit. It's going to take place all across the country in March to kind of launch this initiative. So we're really excited, and I'm helping to plan that and then create what will come out of that, as well as I'm on some committees that you can see listed here. So associations really run on the standing committees that are made up of our members, but then also staff members at the association. So I sit on a few of those to work on things like what are the specific outcomes and basically standards that we want the students to come out of pharmacy school with. So I help with all of that. And in my position, I report to basically the 2 vice presidents that are part of the association, although I pretty much work with every individual at the association. We're a pretty small group. There's about a little less than 40 of us. So we're all really close to each other. And I really love the people that I get to work with. And we're all really dedicated to our members and serving those faculty members across the country to ultimately make sure that the students have the best possible experience in pharmacy school and then go out into the world and change practice and innovate in ways that we're really excited about. So that's all I have, but I'm looking forward to talking to you all later if you have anything else or any other questions for me. Thanks.
All right, next we'll go on to APHA. Lori, if you want to tell us a little more.
Sure. Hi, as I said before, I'm Lori and I'm at APHA this year. There are 2 departments within APHA where we have executive residents or a fellow. The foundation is the charitable arm of APHA, and they deal with grants, scholarships, and awards. They have 1 fellow that works with them. And then within the executive residency program, there are 6 of us in APHA. They're divided up into different departments as your core department, but you also rotate through. So whatever your interest is, there is an area that will hit the mark. So I am currently in the education department as my core. I work on developing content for continuing education materials, the annual meeting, certificate training programs, and also the shorter educational pieces that APHA puts out, like the 15 minutes on COVID-19, and a lot of the information that we put out for pharmacists in the field. The pharmacy practice, we have somebody on the call right now, Brittany, who will be in the breakout room if you have questions about the governance area or what goes on in pharmacy practice. We also have publications, and that's also digital. So they do the books, the prep for the NAPLEX, all of the books that APHA publishes, as well as the digital publications, the magazines. The Board of Pharmacy Specialties is the specialty group that does any advanced certification. So if you want to get your board certification in oncology, this would be the group that establishes the tests, does all the metrics, and runs that entire certificate training program. We also have membership relations. If you're one to work with the setting up the annual meeting, work with the students and get everybody coordinated for membership. So definitely a wide array of interest groups represented. Our building, American Pharmacists Association, is approximately 120 employees, and they own the building. It is the only privately owned structure on the National Mall. We do lease out our building to the State Department, so it is run as if you were in a government building. So all of the government requirements for masking do apply, because we also house State Department employees. But APHA has the entire 6th floor to themselves, and that's where the Potomac Terrace is located. That gets rented out as a wedding venue and meeting complex. So I'm sure you've seen our beautiful pictures from up there, but we're happy to have you come over and take a tour if you have any interest. So feel free to pop into our breakout room and talk to us later, and we'll set you up.
Drake, if you want to tell us a little bit more about AMCP.
Yeah, thanks, Jess. And hi again, everybody. Thanks for joining us tonight. I'm going to be speaking about AMCP, or the Academy of Managed Care Pharmacy. And usually I start with explaining who we are, because we're not always as well known as some of the other pharmacy associations. We are a membership-based association. We have individual and corporate members. Our individual members are primarily pharmacists, but we also have physicians, physician assistants, nurse practitioners, and other healthcare providers who work in the managed care space. So you can think those who work for health plans, PBMs or pharmacy benefit managers, pharmaceutical companies, consulting companies, anything really related to the managed care space, that's who we represent. And then on our corporate membership side, those are primarily pharmaceutical and biotech companies who are our corporate members. But really our mission is to help patients get the medications they need at a cost they can afford. So our members are really focused on sort of the population health side of things. And really, like I said, getting patients the medications they need at a cost they can afford. So for our fellowship program, I am actually the first fellow for AMCP, started this year. For the following year, we're going to be recruiting for one position. Starts in July and ends at June the following year. We are located in Alexandria, Virginia, in the Old Town neighborhood, very close to NCPA. For those of you who've never been, it's a beautiful area. What I really like about this fellowship, and for me, what sort of drove me to this position was I was sort of interested in population health and sort of a non-traditional pharmacy career. And what I love about the fellowship program is it prepares you for a career in association management, but also managed care. So if you're interested, like I said, in working for maybe a health plan, a pharmaceutical company, something like that, this fellowship will prepare you to do that as well. So that's that top bullet point there. What I also really enjoy about this program, so I, as the fellow, I'm a direct report to our CEO. So her and I have standing meetings on a weekly basis. We only have about 45 total staff at AMCP, so we're a relatively small organization, and it gives you great opportunity to work across the organization. I also get to sit on our leadership team. So that's with all of the vice presidents at the organization. We have weekly meetings there, really getting to talk about what are our strategic priorities, how are we working to advance those, and how can we make the organization leave as big of an impact as possible. So that's a really exciting thing. I mentioned how it prepares you for a career in association management. So there is, believe it or not, actually an association that represents association professionals. ASAE is the abbreviation for that organization, and they actually have a certification that you can get as a certified association executive. And the curriculum for the fellowship at AMCP is built off of that. So there are 8 different domains that cut across things like government, governance, finance, professional practice, things like that. So you really get broad exposure and a dedicated curriculum and activities to each of those areas. And then the last piece that I really enjoy about this fellowship, or what I really think is unique, is it is very customizable. For me, having the interest in the pharmacy background, I spend a lot of time working with our professional affairs team. So those are typically the pharmacists who are working to advance the practice of managed care. And they're working with a lot of our members on a day-to-day basis on some key issues like value-based contracting, digital therapeutics, addressing health disparities, things like that. But I also get to work a lot with our business strategies teams. They work with our corporate members who sponsor a lot of our events. We hold partnership forums, our 2 meetings that we have per year, our other roundtable and market insight events that they get to work a lot with our corporate partners. So I get to do that. And what I'm most excited for the back half of the fellowship is I'm going to get to set up some different shadowing experiences and also have the opportunity to work on some collaborative projects that may cut across different AMCP departments, or maybe with an external organization who may be a member of AMCP, and really working to advance our strategic priorities as well as the practice of managed care pharmacy. So those are a few things that I really enjoy and sort of what drew me to the program. I know managed care is a little bit unusual of a career path for a lot of pharmacy students, but would love to answer any questions or talk more about the field during the breakout session. So thanks for joining.
Next up, we'll hear from ASHP.
Hi, everyone. As I mentioned before, my name is Marissa. I'm one of the ASHP Executive Fellows for this year. This is the American Society of Health System Pharmacists. We have about 57,000 members, and our members are pharmacists, pharmacy technicians, pharmacy students within health systems. And our office is located within Bethesda, Maryland. It's just outside of Washington, D.C. This year, we actually have 3 fellows. In the past, we've had anywhere from 1 fellow to 2 fellows. This year, we had 3. And we currently are going through our recruitment process. So you can go to our page and you can find out more information there in terms of like all the application details. Some unique features about our organization is that we are directly underneath the CEO and the COO. So we have monthly meetings with them. We actually meet quite often with our COO, and we have lunches and things like that. We also have coordinators for our program, and we experience all of the areas of not-for-profit association leadership. It's a great opportunity to meet with other pharmacy leaders as well through projects and all of the networking opportunities that we have during the fellowship. There's a lot of growth and opportunity to network and really meet others in this area. Leadership and management for strategic planning and policy process activities is a big part of ASHP. We actually have the opportunity to meet with the committees in our policy week, and we are able to sit in on those meetings, see how policy is discussed, and then eventually those conversations and discussions are taken up to our senior leadership team and then to our board of directors to be voted on. And we have a really strong government affairs office that they lobby on the Hill, and they do a lot of really good advocacy for our pharmacists. So that's a really awesome experience to have as well. And then we support the conceptualization and management of a wide array of meetings and other events. You may have heard of the mid-year clinical meeting. That's one of our largest meetings. It's actually the largest pharmacy gathering in the world. That's coming up in December, and we're really excited about that. We actually had a meeting about that today, and we got to see the virtual platform. So we're really excited to see how that goes. We have other meetings as well, like our summer meetings, and we also have leaders and preceptors meetings, which happened recently. So as an executive fellow, we do partake in those, and we get to help plan them as well as staff them and attend. We get to experience all of the CE educational sessions and things like that as well. So that's a really great opportunity. And then we also assist in the development of educational sessions, member resources, and services. We have a lot of different projects that we're working on all the time. It's not really a rotation-based type of fellowship program. We kind of just have longitudinal projects, some of which are individual, which is really nice because you get to own projects and really enhance your leadership skills, communication skills, all of those really nice professional development opportunities. But we also get to have team building and network or team building activities as well, where we're working in a group. So that's a really great opportunity as well to connect with your co-fellows. And we do a lot of different things like developing certificates. We are doing a number of new projects as well. So it's really great to have opportunity to be possibly published even through AJHP and some of the other resources that we provide on our website. So if you have any questions for us, we will be around in the breakout sessions. You can also go to our executive fellow page, and if you are attending mid-year, we'll be there as well to talk to you.
Carmen, if you want to introduce yourself and tell us a little bit more about ASCP.
Hello, everyone. My name is Carmen, and I am the Executive Fellow for AACP, which is the American Society for Consultant Pharmacists. And I know consultant pharmacist is not something you hear a lot about, but essentially consultant pharmacist means senior care pharmacists. So any pharmacist who works in senior care, whether they're doing long-term care, whether they're a consultant on their own, whether they work in a hospital, or we have a lot of community members as well. So a lot of pharmacists in a lot of settings treat the older adult population. So that's kind of the organization that we are. We support anyone who treats older patients. So we, like Drake and Jessica, are we're all in Alexandria, Virginia, so downtown Alexandria, yeah, so we're all very close. And we have one fellow, so it's me, and then we are a 2-year position as well. So we will be recruiting for 2023 to 2025. But if you or any of your friends are interested, you can reach out to me at any time. So the main focus for the fellowship is going to be policy and legislation. So a main part of my role is to be up to date on any changes in practice and changes in regulations in long-term care. And as you can imagine, there's lots of changes with COVID, especially with vaccine requirements and OSHA standards that are changing by the minute. So we have to be up to date on that because our members come to us for help, and we are kind of the liaison between the government policies the government organizations who are making these decisions and the pharmacists who are actually on the ground doing the work. So we're kind of the liaison there. And honestly, I've been so impressed by the amount of work that AACP does in this space. We are also small, like AMCP and some of the other organizations. I think about 40 people as well. But the amount of impact that we have had on monoclonal antibody distribution and making sure that pharmacies and hospitals and long-term care facilities are getting their products has been really amazing to see. So that's a main part of my fellowship, is being involved, making comment letters to CMS, the DEA, whoever's involved. We make a lot of comment letters. We go to a lot of meetings where we're basically trying to, chip at them slowly to make changes that help pharmacists and patients at the end of the day. And then another huge part of my position is being the direct APHA preceptor. So if you are interested in mentoring, interested in teaching students, or maybe think that you want to be a professor one day, I really suggest this because you are in full control of the student. Of course, you have help, but you can really work with them and have them work with you on projects that they want, or kind of develop their own plan. And I think that as a new grad, I just graduated this past May, it's been really helpful to work with students because they teach you just as much as you teach them. So I think if you are interested in also working with students and maybe being a professor one day, that will also help you. And then, so this is my first year of the fellowship. Next year kind of gets more clinical based. So I will still be involved with all of the legislative and policy changes, but I also will be doing consulting. So consulting is when a pharmacist goes into a long-term care facility or nursing facility and makes the recommendations that are required by CMS at least once a month. So I will be doing that for part of my time next year as well. So if you are also thinking you want to do clinical path, this is also the role for you. So the reason I chose this position is because I have so many ideas of what I want to do, but I want to try them out and see what I can see myself doing long term. And this position gives me the autonomy that I wanted. And I get to meet with so many people that have made such a big change in their patients' lives, and also just impacting the profession of pharmacy as a whole. So if you're interested in senior care pharmacy in any aspect, teaching, legislation, policy, even medical writing, we do everything here, and the fellowship is kind of what you make of it. I would definitely suggest that you reach out to me, and also just check out any of the blogs from our previous APHA students if that's something that you would want to check out before applying for the fellowship. Thanks.
Next up, hold on, gotta reshare my screen. From NACDS, Tanya, if you want to tell us a little bit more.
Hi, everyone. My name is Tanya Ganem. I am the Executive Fellow at the NACDS. That is for the National Association of Chain Drug Stores. We are also located in Alexandria. Right now, we're on a voluntary in-person or remote status. So I'm actually working remote. I am based in Chicago, and I've been working remote this entire time. And so we're recruiting for this next year, the 2022-2023 fellow. And at this time, it's also remote, but has that voluntary aspect if you are willing to move to the DC area. So we are recruiting for one position. I am the sole fellow right now. What's really unique about this position is that I'm technically the NACDS Foundation Fellow. So we do have two aspects of NACDS. There is the trade side, which is regular NACDS, and then there's the NACDS Foundation. What's really interesting is that just because I am the fellow on the foundation side, it doesn't mean I can't work on the trade side. So I have a lot of roles that really go to both sides of the organization, but it is really important to point out that they are two completely separate entities. We are a unique organization in that our members are chain pharmacies. So what really constitutes a chain pharmacy is any store that has 4 or more locations. So we have your typical community pharmacies that you see, like CVS, Walgreens, Albertsons, Kroger's. Those are all of our members. And then we also have large corporations and pharma companies as well, like AbbVie, Abbott. Those are the kinds of members that we have, but you can't really join as an individual member. So ways for you to get involved as an individual is to complete our APHA rotation or do the executive fellowship. Some of the unique features that are listed here really encompass my role as the executive fellow here. So Be the Change really talks about the different research projects that we really participate in. So the foundation is very driven by research in community pharmacies and advocating for, patient health and positive outcomes, health outcomes, patient equity and whatnot. So we work with researchers all over the country. Right now we have about 7 projects that we're working on. And as the executive fellow, you would pretty much be the project manager. So you would make sure that everybody's staying on task, that they're meeting their milestones. You're in charge of reporting back the data, the statistics that they, of the results that they would acquire throughout these projects, and then also provide like lessons learned to these researchers throughout the country. So NACDS Foundation has worked with a lot of different research projects over the years. So we really have a good idea of what works and what doesn't. So we really provide advice when needed as well. Other things that I do as the executive fellow, I do work as the APHA preceptor as well, as I think Carmen just said. So that's been very interesting. It really gives you a different aspect of pharmacy. I didn't think that I would ever be good at teaching, but it really gives you the opportunity to teach and to be in that role. I did just graduate in May as well. So it's given me the opportunity to really be on the other side of the table, to apply the different knowledge that I've learned throughout pharmacy school, and really give back to students as well. Also, the APHA rotation is kind of like a prequel to the fellowship. So if interested, I tell a lot of the APHA students, this is really similar to what the fellow would do, and tell us go ahead and apply for fellowship because they're already halfway there. We are a very small team. We are about 40, 50 individuals, but we come from a lot of different backgrounds. So there's about 6 or 7 pharmacists only on staff. The rest are lawyers, policymakers, people who work in different organizations, and we all come together as one team. So since we are a small team, the fellow does work very closely with everybody. We do have, like I said, this one team aspect where everyone's kind of working together on everything. We do a lot of comment letters as well, where we're advocating for patients, patient care, health equity, and also on the trade side, we are advocating for the role of pharmacists and the progression of pharmacy, as well as the role of provider status. So there's a lot of different aspects to this fellowship. You do have the opportunity to touch base with, the community side and patient care. And then you're also working on advocacy issues, policy making and whatnot. So it's very diverse. If you have any questions, please feel free to reach out during the breakout session. I'd be happy to answer any questions. Thanks.
All right. Thank you, Tanya. I actually, I'm a preceptor as well, and our students actually get to talk to each other a lot within NACDS and NCPA. So if you haven't applied for rotations yet, any of our organizations have rotations, and they're just such a wonderful experience. So next up is me. So in case you're just joining or you joined a little late, my name is Jessica Satterfield. I'm the NCPA executive resident. So we're located in Old Town, Alexandria, Virginia, right off the King Street Metro. So it really is a great area to be in. You've got walking everywhere. We've got, we just went to an A&R workshop to go paint things together after work. It's really, really a good time. So we recruit for 1 position per year, 1 executive resident. As far as unique features, so we're really involved with education, strategic initiatives, and the Innovation Center. The executive residency is housed in the Innovation Center. So that's what you pretty much get absorbed into in the first few months, especially with the involvement of planning for annual convention. So you do get to plan for annual convention, do development of your own program. You get to run a couple different sessions together. This year I put together about 12 of our non-CE sessions that went on during the expo. So that's a great networking opportunity. It is a challenge as you just go in and they say, all right, what do you want to do? But then you have complete autonomy and they're there to help you. They really want you to learn. So I really enjoy working with our team specifically. They're very supportive. And they want to reach your goals. But strategic initiatives, that's a different word. That's not something that you typically hear in pharmacy school, but I feel like enough of us have said it. So those are like your special projects in my mind. So like we have a partnership with CDC to do a diabetes prevention program that's housed within independent community pharmacies. So our organization, in case I didn't mention it, we're focused on independent community pharmacies and building their business. We also have a pretty heavy hand in advocacy. We've got one of the larger PACs, so there is some involvement with that, but really it's whatever you want it to be. So strategic initiatives, we do have the diabetes prevention program. We also house our fellowship in there, which is like if you were working in a community pharmacy, you would do an NCPA community pharmacy fellowship. The Innovation Center, that's where all of our education comes from, all of the new ideas, all of these special projects. Like I work with the University of Southern California on a pharmacy deserts initiatives. That's in the Innovation Center. So again, your year is based around your goals. So whether it's ownership, administration, advocacy, if it's education, or if you want to go into association management, they're going to make that happen for you. Our past residents have gone on to ownership. Several of them are still with the association, whether it be our education director, who has been there for several years now. She runs the LTC division. She was hired on after just 3 months. Another one of our fellows works for NASPA, which is like the umbrella group of all of our alphabet soup of pharmacy associations on this call. So I would love to tell you any more about it if you join the breakout rooms. And next up, we've got Alexis from PQA.
Hi, everyone. So I'm Alexis, and I'm the Executive Fellow at PQA. We just have one fellow per year. So PQA, as a student, I didn't really know too much about it, except I had some mentors who had, out that acronym, and I was like, okay, cool. So PQA does quality measurement, and that was what they were founded to do. And I know like that might sound really abstract. And so basically, if you think of star ratings, it's all of those individual measures and building those and then maintaining them and updating them as needed. And then from there, we expanded and did the research needed to explore what else needs to be measured in the quality landscape. And then the education that goes along with that, and saying, how do you teach people about quality? How do you teach them to implement the measures into the correct way, basically, and get the data they need to improve the quality of care that patients get. And then we have convening, so bringing all these stakeholders together who are involved in pharmacy quality to come together and create a strategic plan, not just for PQA, but for the healthcare quality landscape as a whole, and say, how can health plans and PBMs and pharmacies and health systems and life sciences all work together in the associations to improve the quality of care patients get at the end of the day. And so with those 4 roles, the convening, education, development, and research, each year the fellow comes in and decides how much or how little they want to expose to all 4 of those roles. And then your projects are crafted from there. So I came in wanting to do a little bit of research and a moderate amount of convening and networking and engaging with our members and figuring out how do you provide members great value. And then the education is where I am heavily involved in. So I also am a preceptor for APHA students. I just had 2 in September, and we have 2 more in February, which I'm really excited about. And then the other things I do are help develop like 4-hour quality workshops for life science companies where we go on site or virtual with them and just teach their organization about quality and help them develop their quality strategies. And then I also help with the medication use quality CE program we have. It's a 15-hour certificate, but then we've just launched 4-hour live workshops as well with that. And so really, those were the things that I wanted in event planning. So it's really whatever the fellow wants, but the ability to engage with diverse stakeholders, the technology vendors, these health plans, the pharmacies themselves, the other associations, all in one room basically, which we just did at our leadership summit last week, is really incredible to see the amount of progress and strides they take and how collaborative they are. You also develop your association and nonprofit management skills, which I think is something we all on this call have experienced this year. And then I put collaborate on educational and research projects as you desire because that's where I focused. But PQA as a whole, like I said, is very open to letting you dive as deep or as shallow as you want in any role that we have. So if you have any questions, I would love to talk to you guys in the breakout room.
Next, we've got our last presenter from PTCB, and Ariel Clark just got off a plane to join us for this. So thank you for coming by. We really appreciate
thank you. Can you guys hear me okay? I've got to keep my mask on because I'm in the airport, but yes, happy to be here. Thanks, Jess. So my name is Ariel Clark. I am the executive fellow with PTCB. I'm sure most of you who have worked in pharmacies or done internships through pharmacy school know about PTCB. It's the credentialing agency that certifies technicians and helps to advance pharmacy technician practice. So our main office for PTCB is located in Washington, D.C. in the APHA building on the first floor. However, my fellowship has been fully remote. I've done quite a bit of travel along with my position, but it is fully remote as I'm actually, when I'm at home, I am located in Connecticut and I work fully remotely. So the PTCB mission has always been to advance medication safety by credentialing pharmacy technicians with the goal of supporting pharmacists. So for those of you who don't know, PTCB was founded originally in 1995, and we have certified over 700,000 pharmacy technicians with our certification exam, the PTCE. And since then, we've continued to develop our programming to support technicians working at the peak of their license. So in 2017, PTCB launched the Certified Sterile Compounding Pharmacy Technician certification, as well as our assessment-based certificates, which were started in 2019. And now we have our CPHT Advanced, which is the Advanced Pharmacy Technician credential that technicians can earn. So a lot of my training for this fellowship centers around specialized training and credentialing. So I work with our test development team a lot. I might have the smallest staff of all of the associations who are on this call right now. PTCB has officially 30 employees. I am the 30th employee, and we do have one fellow per year. I'm actually the second fellow that's been with PTCB since they started their fellowship program last year. So like I said, I do work with our test development team a lot with our item writing and our assessment-based certificate development. And that includes several different departments. I work really closely because we're a small organization. I work very closely with all of the departments at PTCB, including the test development, marketing and communications, as well as finance, to make sure that we are producing a product that is going to help technicians advance their careers. So again, like every association on this call, we're a nonprofit. So I do a lot of leadership training. Oh, check. So I do work very closely with all of the members of our team, including our CEO. The team that I'm specifically on is called Partnership Development, which is our kind of pharmacy-based team. We have three pharmacists, including me, and 2 technicians who work in our team. And we do a lot of outreach activities with our pharmacy stakeholders. So this is kind of twofold. On one hand, our pharmacy stakeholders include our pharmacies that pay for their technicians to do our credentialing, including the PTCE and the ABCs. And then our other hand of that is like state boards of pharmacy and managing of the regulatory landscape for pharmacy technicians. This has been pretty significant over the last year and a half or so since COVID, with the publishing of the PrEP Act and the allowances for pharmacy technicians to do additional activities, including immunizations as well as point of care. So my interest in this fellowship is really based on the fact that I worked as a technician for 10 years before coming to pharmacy school. So that's really where I took a shine to this particular fellowship, because I really think that we wouldn't be able to do our job as pharmacists without technicians. And I think it's amazing the things that PTCB is doing and is continuing to do. And we're constantly assessing what pharmacies and pharmacists out in the workforce are looking for in their technicians, and then developing of the criteria and the programming to assess the training that those technicians are getting. So yeah, like I said, I am a fully remote experience, but lots of travel. It's a little bit less with COVID, but I have gone on 5 trips so far since my fellowship started. So it's about 1 to 2 a month, depending on the month. A little bit less now that we're going into the holidays, and hopefully more in the spring, as we maybe loosen some of the COVID restrictions and get moving in a positive direction there. So yes, I would be happy to answer any questions that anyone has as we move into the breakout session.